Hello, 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 doctors. Good morning, good morning, good morning. Wherever you are joining us from, I'm trying to share my screen. So please kindly let me know first, can you hear me? And if yes, can you let me know whether you can see my screen? Because I'm trying to share my screen, but I don't know how to do it. Okay, so share screen. Let me see. I'm just trying to share my screen, but I don't know whether you can see it. Okay, so looks like people say they can see it, but sorry, I'm not very technologically savvy. So I'm just trying to sort it out here. Okay, so screen. Let me see. Share screen. Uh, I'm just trying to. I don't know what to do. Okay, you can see my screen, but yeah, I'm confused here a little bit. But please, we'll sort this out. We'll sort this out right away. So let me see. Okay, this screen. Okay, so doctors, please, I want to ask. I'm moving my screen. Can you see the movement? Can you see that I've moved my screen, please? Can you see that I've moved my screen? Um. Oh, okay. I was trying to move my screen, but I don't know whether you see it. No, okay. I can't move my screen. So, someone is saying that no, Dr. Boni, you can't move your screen. Uh, what do I do? I wish somebody is tech savvy to help me, but that is fine. I think let's do it this way. Okay. So when I move the screen here, I'll move it here. Okay, good. So doctors, we're not going to allow the screen to bother us. We're going to move with the flow. So welcome, welcome, welcome to today's approach to personality disorders. Okay. Today is packed because this is the first day that we're going to have a class in the afternoon, and those in MedCognita are also going to have a class tonight. Tonight's class is on respirology. So you were still invited to join us, but I just wanted you to know that, look, we have a packed day. We have a packed day. So what we're going to do is I'm going to start and let you know that, sorry, so let me see this. Okay. So I'm going to start and let you know that we have quite a number of programs going on as well in MedCognito, okay? And one of the programs which we run, apart from the MCCQE1, is also the NACOSKI class. So that's also something you want to pay attention to. If you are planning on writing your NACOSKI, let us know. Just shoot me a text. I'm going to let my phone number run below the screen. So it is +1 306 891 5649 +1 306 891 5649. Reach out and let's see how things go. Okay. So back to approach to personality disorders. I'll be moving between two screens. I don't really know how to manage it well, so please forgive me. Okay. So today, we're going to get to the rationale for the approach to personality disorders. Rationale. It says that personality disorders are pervasive and maladaptive. Okay, so they are pervasive and they are maladaptive, and patterns of behavior exhibited over a wide range of social sorry doctors, I'm just trying to get this thing right. Okay, so personality disorders are pervasive and maladaptive patterns of behavior which are exhibited over a wide variety of social, cultural, occupational, and relationship contexts, and leading to distress and impairment. All right. Now, they represent important risk factors for a variety of medical, interpersonal, and psychiatric difficulties. So that's something you want to really, really pay attention to. Personality disorders. Remember that they are pervasive, maladaptive patterns. They are patterns of behavior, all right? And the objective is saying that usually you see it over various situations, cultural, occupational, relationship context. And the other part of the rationale, which is very interesting to me, is that the medical council wants you to know that they represent important risk factors for a variety of medical, interpersonal, and psychiatric difficulties. So when you're learning this particular objective, apart from learning the various personality disorders, one other thing you also have to ask yourself, what are the risk factors or what are the medical conditions which can come up as a result of these risk factors? Okay, so the causal conditions are: the emergence of a personality disorder is a complex interaction of biological, social, and psychological factors, okay, like stress. Now, if you go to the key objective, it states something very interesting, that if you have a patient with a personality disorder, the candidate will differentiate between a personality disorder and other mental illnesses, all right? And recognizing the high prevalence of comorbidities. So you realize that even in the key objectives, they've brought the issue of comorbidities again, okay? And the candidates will formulate an appropriate management plan. So first, if I'm supposed to break it down, you need to know, number one, the various personality disorders. Number two, the conditions which can come up as a result of these personality disorders, which are comorbidities. And number three, you need to know the management of each of the personality disorders. So the enabling objectives. Given a patient with a personality disorder, the candidate will list and interpret critical clinical findings, including sufficient clinical information to diagnose the type of personality disorder. And today we will really deal with that. And risk factors associated with personality disorders and coexisting psychiatric conditions, all right, like mood disorders and all those things. And construct an effective initial management plan, including the proper management in the case of a patient requiring immediate intervention, so like suicide risk, risk to others, and judicious use of pharmacotherapy with consideration of the risk of abuse or overdose, and referral to multidisciplinary and specialized care if necessary. So doctors, these are the things you need to know. So when you are reading personality disorders, you need to also know risk factors for suicide. And those in MedCognito, you already have that in your psychiatry portal, all right? And also, you can also find it in some of the med bullets as well, which is found in the family medicine portal. And you've got to know, okay, what are the risk factors for, danger to other people? And then you have to know, what pharmacotherapy can I use for the various personality disorders? So, like we do, let's try some questions. First, you have a 25-year-old man who comes to the clinic for evaluation of difficulties maintaining close relationships. He says he prefers being alone and finds little pleasure in social activities. On further questioning, he reports no psychotic symptoms, but appears emotionally detached. Due to the conversation, which of the following personality disorders is most likely the diagnosis? A, paranoid personality disorder. B, schizoid personality disorder. C, schizotypal personality disorder. And D, avoidant personality disorder. Please, let's start the questions. Please start sharing your thoughts. Share your thoughts. Is it A? Is it B? Is it C? Is it D? Is it E? Or is it D? Is it A? Is it B? Is it C? Or is it D? Please share your thoughts. Some candidates are asking me on WhatsApp, whether we've started. I'm telling them, yes, we've started the class. So, doctors, is it A? Is it B? Is it C? Is it D? So I can see that it looks like there's a competition between B and D. B and D. It looks like there's a competition going on there between B and D. Between B and D. And what is the answer? So you have a 25-year-old man who comes to the clinic for evaluation of difficulties maintaining close relationships. He says he prefers being alone and finds little pleasure in social activities. You know, on further questioning, he reports no psychotic symptoms but appears emotionally detached during the conversation. Which of the following personality disorders is the most likely diagnosis? And the answer, drum roll, is B, schizoid, 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 schizoid. So Dr. Kolawole, please check your answer again, okay? It's not D, it's rather B. B for boy, schizoid. Now, let's take our time and get into it. Take our time and get into it. So, schizoid personality disorder. Remember that I'll be doing a deep dive, but we are using the question to really get our mind to it. So, schizoid personality disorder, that is the correct answer, because usually these patients, they demonstrate a hallmark features of like social detachment. Emotionally, they are cold, all right, and they prefer to be isolated or to be in their own solitude. Meanwhile, paranoid personality disorder is wrong, because usually for the paranoid personality disorder, they have a lot of distrust, they have suspicion for other people, you know, but that is not what is described in the question stem. And then for schizotypal personality disorder, that's also incorrect, because with schizotypal, these people, they have magical thinking. They have magical thinking, which are absent in this particular patient. And for the avoidant personality disorder, that's also wrong, because it's incorrect, because with avoidant personality disorder, it includes social inhibition due to the fear of being rejected. This person does not like people, not that he's afraid of being rejected, but in the avoidant personality disorder, they are afraid of being rejected, which is not evident in this particular situation. All right. So Dr. Ibironke, I really like this doctor's spirit, right? She's very forceful. She says they prefer being alone, and no pleasure is the key point. Beautiful. So let's go to the next question. You have a 32-year-old woman frequently becomes overly emotional and seeks constant attention at work. Meanwhile, you know that work is work. You go to work to make money and to take care of your family, right? You don't go to work to seek attention. Oh, woe is me, you know, that kind of thing. You know, she dresses provocatively and often exaggerates her accomplishments. Her co-workers report that she becomes upset when not the center of attention. Which of the following personality disorders best describes her behavior? A, narcissistic personality disorder. B, borderline personality disorder. C, histrionic personality disorder. And D, dependent personality disorder. Is a patient narcissistic personality disorder, borderline personality disorder? So Dr. Stephanie is giving me some explanations in the comment section. She says that C, she dresses provocatively and desires to have the center of attraction. That's what she's saying. Dr. Aaron Smith also goes for C, but it looks like Dr. Faradiba rather went for A, narcissistic personality disorder. So what is the what is the correct answer? The correct answer is C, histrionic personality disorder. Why? In histrionic personality disorder, the patient has a need for attention. They have emotional excesses. They have provocative behavior. And those are the symptoms. Okay? Why is narcissistic personality disorder wrong? Narcissism involves a sense of entitlement, and usually they lack empathy. But I realize that this person is seeking attention. This person is not bossy. So narcissism, usually those people, they feel bossy. But histrionic, they need attention, the woe is me, have mercy on, that kind of thing. And they dress to stand out, right? So they use very wild colors, when they are dressing, okay? And then borderline personality disorder is incorrect, because borderline personality disorder typically involves emotional instability and fear of abandonment, not attention-seeking behavior. So doctors, please notice that very well. And then dependent personality disorder is also incorrect. That is D, because independent personality disorder, it involves, somebody who is very submissive and they are clingy, right? And which is not related to this particular case. So doctors, please, let's take note of that. Histrionic versus narcissism. A lot of people got that one wrong. By the way, please, before we move on, click on the like button or the subscribe button on YouTube so that we can get this information to as many doctors as possible. Please, before we go on, click on the YouTube, the subscription button, and also like the video on YouTube and Facebook, so that we can get this to as many doctors as possible. As many doctors as possible. Please go there and like it right away. Like it. We have only 3 likes. We need 100 likes today, okay? And 100 subscriptions today. So please do it. We have 104 people on the stream right now. Let's do it. Let's get going. Good. The likes are increasing. Beautiful. Let's get to the next question. You have a 40-year-old woman or a 40-year-old man who has a history of violent social norms and engaging in criminal behavior. He lacks remorse for his actions and repeatedly lies to get what he wants. I'm sure a lot of you know what I'm describing, but the question has been twisted. He's been diagnosed with a personality disorder, which are the following clusters. So, I know you know the personality disorder, but I'm not going to ask you a question about the personality disorder. I'm taking it to the next level. Which of the following clusters best describes his condition? So the question is, basically, you've got to know the clusters of personality disorder as well. Is it cluster A? Is it cluster B? Is it cluster C? Or it is none of the above? Okay? So what I'm trying to tell you is that it is not enough to know the type of personality disorder. You also need to know the cluster there. So is it A? Is it cluster A? Is it cluster B? Is it cluster C? Or it is none of the above? Doctors, please keep like and sharing the YouTube. Please like and share it. So this patient, is it cluster A, cluster B, or cluster C? By the way, before we move on, what personality disorder does this patient have? That's the first question I need to ask. What personality disorder does this patient have before we go to the cluster? I see a lot of answers. Some are going for B. Someone also says D, none of the above. Dr. Irene says B. Dr. Sabine says B. Lots of people are going for B. Dr. Misbao says B. So first, let's ask ourselves. Okay, so Dr. Adaga says that is antisocial personality disorder. So now the question is, it's a 2-tier question. So now that you've identified that this is antisocial, which cluster does antisocial personality disorder belong to? And the answer is B. So antisocial personality. So these people, they are dramatic, they are emotional, and they are erratic. Okay? They are dramatic, they are emotional, and they are erratic. So that is B. So B, cluster B. They are dramatic, they are emotional, and they are erratic. So think about it. Dramatic, emotional, erratic. You can do things anyhow, right? So cluster B is the correct answer. Where you see, so that is where antisocial personality disorder comes in. Okay, it is characterized by criminal behavior and lack of remorse. and antisocial personality disorder belongs to cluster B. So doctors, please don't just learn the personality disorders. Also learn the clusters under which the personality disorders fall. Okay, don't just learn the personality disorder. Please learn the cluster under which the personality disorder also forms. So what is cluster A? Cluster A is usually, they are odd, they are eccentric, right? So it includes paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. And cluster C, these people are anxious and they are fearful. So the disorders here are the avoidant personality disorder, the dependent personality disorder, and the obsessive compulsive disorder. So think about it this way. Cluster A, they are odd and eccentric. Please write it in your book. Write it in your book right now before I move on. They are odd and eccentric. Paranoid, he's odd. Schizoid, wants to be alone. Schizotypal, okay? Cluster B, they are dramatic, they are very emotional, they are erratic. So, like, they do also. And then, under which we have antisocial personality disorder, narcissistic personality disorder, right? And then cluster C, these ones are anxious and fearful. Okay, so like avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. Doctors, before I move on, I want to make sure you've grabbed this concept. So if you've grabbed it, type yes, yes, yes. If you've grabbed the clusters, cluster A, cluster B, cluster C, let me know. If you've not grabbed it as well, let me know. Remember, we're going to do a deep dive, but this is just solving some questions. Please, I want to know, can I move on? Because I don't want to move on before you go. Okay, so I'm getting a lot of messages that Dr. Brony, please move on, move on, move on, move on. Okay, good. So that's good. Okay, sure. So I think it's clear now, right? Okay, good. So now, you have a 28-year-old woman who avoids job opportunities requiring interpersonal interactions due to the fear of criticism. She expresses feelings of inadequacy and is preoccupied with fears of rejection. Which of the following is the most likely diagnosis? A, avoidant personality disorder. B, obsessive compulsive personality disorder. C, dependent personality disorder. And D, borderline personality disorder. Is it A? Is it B? Is it C? Is it D? Is it avoidant personality disorder? The person doesn't want to take job opportunities which require interpersonal interactions. They're afraid of criticism. Okay, so Dr. Stephanie is giving me a lot of sentences. It says avoidance as she avoids interpersonal interactions due to fear of criticism. Okay, so what's the answer? The answer is avoidant personality disorder. It looks like this one, a lot of people got it right? So avoidant personality disorder involves social inhibition, feelings of inadequacy, fear of being criticized or rejected. Meanwhile, with obsessive compulsive disorder, that is incorrect, because in obsessive compulsive disorder, there is preoccupation with orderliness. The person is very orderly. They want their pen in a particular place. They want the doorknob in a particular way. They want everything orderly. All right. And dependent personality disorder is marked with excessive reliance on other people in decision making. So these people, they can't even make decisions on their own. If they have to make a decision, they want to seek everybody's idea at the office before they make a single decision about even what to eat, right? And these are things you need to be able to pick up in your clinical practice and as you prepare for your ultimate MCCQE1 exam. And borderline personality disorder, it involves unstable relationships, emotional instability, okay? And that is what is not described there. So now, doctors, Please, are we okay with the questions? Are we okay with the questions so far? The way we address the questions, the way we answered, are you okay? I want to know. Are you okay? Are you okay? If you're okay, let me know. Say, Dr. Boni, I am okay. Then let's move on to the deep dive into introduction to personality disorders, okay? Sure. So we're going to do a deep dive into introduction to personality disorders. So, personality disorders, we have a general diagnostic criteria. So I need you to write this on your study pad and your notebooks as you're taking your notes. Always remember CAIPEN, C-A-I-P-E-N, 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 CAIPEN. So remember that the medical council told us that we need to know how to identify them. We need to know the criteria. We need to know that there is not any other underlying psychiatric condition leading to this. So how are you going to remember that? CAIPEN, C-A-I-P-E-N. So the diagnostic criteria for patients with personality disorder, they have distorted ways of interpreting themselves, others, and events. So that's why you can have avoidant personality disorder, schizotypal personality disorder, schizoid personality disorder, narcissistic personality disorder, right? And it also affects their affectivity, okay? They have abnormal range of intensity of emotional responses. That's why you can have, like, the antisocial personality disorder being very erratic. And then it also affects their interpersonal functioning. So there can be poor relationships or social skills. And there can be concerns with impulse control, trouble managing their urges. That's why you can have someone with, obsessive compulsive disorder. They cannot trust that their door is knocked until they come back there 5 times or 6 times to check on it. Okay. And these symptoms, they are enduring. They have an enduring nature. And it persists across life stages. And you cannot better explain it with another condition, like maybe if the patient is taking any substances or not. Okay. So now remember we talked about the class test. Now let's take the class test one by one and get into it. Let me get some water. Doctors, please, I have a question. Am I moving too fast? Am I moving too fast? If I'm moving too fast, say too fast. If I'm not moving too fast, say normal. If I'm moving too fast, please tell me too fast. If I'm not moving too fast as well, just let me know that it's normal. If I'm moving too fast, please say too fast. Okay. So no. Dr. Ogina says no. No. Okay. That's good. All right. So let's move on then. So cluster A, remember we said we have cluster A, B, and C. So in personality disorders, I needed to go back to nursery school when you are learning the alphabet A, B, C, A, B, C, D, E, F. Just remember that now I know my A, B, C. A is for cluster A, cluster B, we have cluster C. Okay, good. So cluster A, what are the components of cluster A? Cluster A personality disorder, these guys, to remember it, I've coined the acronym PSS. Okay, PSS, cluster A, PSS. And maybe you may want to write this in your notebook. Paranoid people avoid crowds and prefer their quirky world. Let me say it again. Paranoid people avoid crowds and prefer their quirky world. Let me say that again. Paranoid people avoid crowds, that is schizoid, and prefer their quirky world, that is schizotypal. So paranoid, so what are the components of cluster A? Paranoid people avoid crowds and prefer their quirky world. Paranoid people avoid crowds and prefer their quirky world. Paranoid people avoid crowds and prefer their quirky world. Let me say it for the last time. Paranoid people avoid crowds and prefer their quirky world. That is PSS. So paranoid, schizoid, schizotypal. All right. So it is not enough to just know these, but you need to know how each of these people present. Okay. So Paranoid personality disorder, they are suspicious, they are distrustful, and they interpret everything as malicious. Oh, everybody is out there to get me. Paranoia. Paranoid, distrustful, interprets everything as malicious. So let's do a deep dive into paranoid personality disorder. They have suspicion without basis, and they believe that without sufficient basis that others are exploiting them or harming them or deceiving them. They have preoccupation with doubts, right? They are reluctant to confide in other people because they fear that if I confide in somebody, that person will use that against me. And they read hidden meanings into things. Okay, I've provided further notes. So if you want to, I'm just hitting on the high points. So if you want, you can just read what comes after that. And they persistently hold grudges. I'm sure in our lives we've seen some people like that in our practice, even in our families, right? And they perceive that they are always being attacked. They perceive that they are always being attacked, and their suspicions are unjustified. So they have recurrent suspicions. There's no justification for it. And regarding fidelity of their spouse or sexual partner, so they are always stalking their spouse or their sexual partner, thinking that person is maybe sleeping around. Paranoid personality disorder. Schizoid personality disorder. These guys are detached. So you can see this gentleman just sitting in his quiet place, doesn't want to really deal with anybody. They prefer being alone. They are emotionally very cold. All right. Now let's do a deep dive into them. So they have a lack of desire for close relationships. They like solitary activities. They like to be alone. Little interest in sexual experiences with another person. Okay, so they don't want to have sexual intercourse with other people. Pleasure in few activities. Indifferent to praise or criticism. So whether you praise him or you don't praise him, whether you criticize him, he doesn't. On the streets, they say he doesn't give a damn about what you're saying. Okay, they are emotionally detached. They display emotional coldness, detached, and flattened affect. And they have lack of close friends. So if you ask them, who is your close friend? Oh, I don't care. They don't really have close friends like that. Beautiful. Doctors, please. Paranoid and schizoid. Can I move on? I don't want to just ramble through it. I want to make sure that we are picking it. So PSS, right? PSS. Paranoid people avoid crowds and keep to their squirky world. PSS. So I want to move to the schizotypal. Please, can I move on? Okay, good. So let's go to schizotypal then. So Dr. Sefe says yes. Okay. So schizotypal, they are eccentric, they have magical thinking, and they have social anxiety. So that's why I put this personality there. You know what? At MedCognito, we pay particular attention to mental health. And we recognize that as doctors who are learning the way we do things in Canada, mental health is a big thing. And so that is why we are doing our best to learn as much as possible so we can ace our exam. So that's why we are focusing on it today. Okay. So what are the features of schizotypal personality disorder? They always have ideas of reference. They believe that events and objects and other people have particular and unusual significance specifically to them. Okay. And they have odd beliefs or magical thinking. And they have unusual perceptual experiences, like, they have bodily illusions or other perceptual experiences that are not typical. And they have odd thinking and speech. They can use metaphorical language or they can be overly elaborate, right? And then they have suspiciousness or paranoid ideation, suspicion without sufficient basis. And they also have inappropriate or constricted affect, and their behavior or appearance is odd, eccentric, and peculiar. So they can dress in unusual manners, as accepted by the society. And they may have odd mannerisms. And they may engage in peculiar behaviors, and they also lack close friends as well, and they may have some form of social anxiety. So I'm sure in your mind you've seen some of your patients who may have, schizotypal personality disorder. Now let's go to the cluster B. So doctors, please, did cluster A make sense? Cluster A. We don't want to move on unless we make sure that everybody is on board. So did cluster A make sense, please? Did cluster A make sense? Cluster A. Did it make sense? Cluster A. Did it make sense, doctors? Cluster A. Okay, good. So now, let's move to cluster B. So cluster B, usually they are dramatic, emotional, and erratic. Dramatic, emotional, and erratic. And cluster A, I said the acronym for cluster A is what? Please, who can remind me? Cluster A. Type it. Cluster A. What letters will you use to remember? Cluster A. I gave you 3 letters. Cluster A. Can you type it? Cluster A. PSS. Beautiful. Cluster A is PSS. So now cluster B is BAHN. BAHN. BAN. BAHN. So cluster A is PSS. Cluster B is BAHN. Borderline personality disorder, antisocial personality disorder, histrionic personality disorder, narcissistic personality disorder. Okay, so we have PSS for cluster A, BAHN for cluster B. PSS cluster A, BAHN for cluster B. Now, the memory tip in cluster B is that borderline emotions and antisocial behavior drive histrionic narcissists wild. If you want to remember that, BAHN, cluster A, PSS, cluster B, BAHN, borderline, antisocial, histrionic, and narcissistic personality disorders. So now let's start with borderline personality disorder. Usually, they have emotional instability, they have fear of abandonment, impulsivity, borderline personality disorder, BAHN, cluster B. Now, let's do a deep dive into that. So they have a fear of being abandoned. Okay, they have intense fear of being left alone, leading to frantic efforts to avoid real or imagined abandonment. So they are ready to go to every extent to keep their partners. Okay, they are ready to please their partners in every way, shape, or form. And they also have unstable relationships because they have a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So, I got the best man in the world. The next day, he's the worst partner in the world, right? And then they have identity disturbance, markedly and persistently unstable self-image or a sense of self, and impulsivity in at least 2 areas that are potentially self-damaging. So they may spend a lot, or they may, engage in unnecessary sexual escapades, or maybe, substance abuse, or reckless driving, or binge eating, right? That is borderline personality disorder for you, all right? Now, they also have affective instability, and they have chronic feelings of emptiness, and they have inappropriate, intense anger or difficulty controlling their anger, all right? And then they also have transient, stress-related paranoid ideation or severe dissociative symptoms, where they feel paranoid or dissociated under stress, not due to substance or use or other medical condition. And then now let's talk about antisocial personality disorder. These guys, they have disregard for other people. They are very manipulative, and they have no remorse. Antisocial, they don't care about you. They don't care about animals. They don't care about hurting you. They are very manipulative, and they show no remorse. All right. Sorry, my slides jumbled up a little bit, but usually they are breaking a lot of rules and laws, and it leads to arrests. Okay, and they are very deceitful, repeated lying. They are con men. They are very impulsive, irritable, and aggressive. okay, and they have reckless disregard for safety, and they engage in activities that are dangerous to themselves and other people, and they are irresponsible. They don't care about fulfilling financial obligations. They don't care about filing their taxes. They don't care about taking care of their family, and in all these things, they lack remorse. They lack remorse. And then we go to the histrionic personality disorder. I put masks there, so it's like they are actors, right? Attention seeking, theatrical, overly emotional. That's histrionic personality disorder. So, cluster A, PSS, cluster B, BAN. Okay, so now let's do a deep dive into histrionic personality disorder. They have constant need for attention. Individuals with histrionic personality disorder often feel uncomfortable when they are not the center of attention. Inappropriate sexual or provocative behavior, where they can use, their physical appearance to draw attention to themselves. So they can dress provocatively, right? And then shallow or rapidly shifting emotions. The emotions can seem exaggerated or theatrical, but they may change quickly. And they use dramatic or vague or impressionistic speech, so overly impressionistic in the way they discuss things. And they are easily influenced by others or by circumstances. Doctors, and they consider relationships more intimate than they are. So they may even have a casual friend who has put these patients in the sister brother cage, but these patients think, oh, she's the love of my life. They consider relationships more intimate than they are. And appearance focused. So there's often an excessive concern with their physical appearance to gain approval. So they dress to gain approval. They paint their lips and their hands, in very wild ways, just to gain attention. And then now let's look at narcissistic personality disorder. Usually they have grandiose, entitled, lack empathy, right? So this is where there's a difference between that and antisocial. So antisocial, they are doing things to hurt people. In narcissistic, they are just grandiose, they feel entitled, right? So they have fantasy of unlimited success. Fantasy of unlimited success. In fact, Dr. Ibironki just put something here, and I think it's very important. When you're looking at histrionic personality disorder, they call their doctors darling. Meanwhile, this is just a doctor-patient relationship, right? But then they take it to the next level. Okay, so that's very good, Dr. Ibironki. So back to narcissistic personality disorder, they believe in the fact that they are special. They are here to save the world, right? And they have the best approach to everything, and they need excess admiration. They require excessive admiration and often fish for compliments, and they have a sense of entitlement. So doctors, this is it. They also, when they are relating with people, they are very exploitative. They take advantage of other people. They lack empathy. They are very envious, okay, and they are arrogant as well. So doctors, in your MCQ1 prep and when you are in the exam, you want to look out, when you are dealing with cases of personality disorders, you want to look out for some of these clues, because that's what will help you to be able to know which personality disorder you are dealing with. So doctors, please type, what is the acronym for cluster A? What is the acronym for cluster B? And also let me know, what are the components of cluster A and what are the components of cluster B before we move to cluster C. And while we are doing that, please don't forget to hit the subscribe button, hit the like button, hit the share button on YouTube, and share it to as many friends as possible. So I want this assignment: components of cluster A, components of cluster B, and what acronym are we going to use? So PSS, ban, beautiful. PSS is paranoid, schizotypal, schizoid. Ban is borderline, narcissistic, histrionic, and antisocial. Okay, good. So now let's go to cluster C. Cluster C is ADO. So PSS, BAHN, and ADO. PSS, cluster A. BAHN, cluster B. ADO, cluster C. So cluster C, avoidant personality disorder, dependent personality disorder, and obsessive compulsive disorder. So the memory tip there is avoidant people depend on obsessive routines. Avoidant people depend on obsessive routines. Let me say that again. Avoidant people depend on obsessive routines. So ADO, avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder. Okay. Now, let's get in there. So avoidant, they are socially inhibited. They fear rejection, and they always feel inadequate. Okay. Avoidant personality disorder. Now, they avoid occupational activities like job-related activities that involve significant interpersonal contact due to the fear of being criticized or rejected. They are unwilling to get involved. They restrain or they are restrained in their intimate relationships. And they are preoccupied with criticism. Okay? He's preoccupied with being criticized or rejected in social circumstances, and therefore will even avoid going into those social circumstances. They are inhibited in new social situations. So they don't know what to do when they are in those situations at all. And they view themselves that they are socially inept. Okay? Oh, I don't think I qualify for this thing. Oh, no. Okay? And they are reluctant to take risks. So they are reluctant to take risks. Dr. Sabine says I should show the previous slide. So I've shown it. Dr. Sabine, this is the previous slide, okay? He says, please, can you show the previous slide? So I've shown it, okay? So I can move on now, okay? And then dependent personality disorders. They need excessive support and they fear separation and they are very clingy. They are always clinging to you, you know? They're always clinging to their friends, their partners. They are very clingy. Need excessive support, fear of being separated, and they are very, very clingy. So they have difficulty in making decisions. They have need for others to assume responsibility for the major aspects of their lives, right? Difficulty in expressing disagreement. They don't want to offend anybody. They don't even want to, step on an ant. Oh my goodness. They lack initiative unless they are pushed and pushed and pushed and pushed, right? And they are ready to go to excessive lengths to obtain nurturance and support from others to the point of volunteering to do things which are unpleasant because they want to cling so much. And they feel uncomfortable or helpless all the time. And there's an urgent search for another relationship because they are always dependent on someone else. And they are preoccupied with the fear of being left. They think that, they can't get on with things and therefore people have to do things for them, right? And this is not like somebody with a commanding presence. Rather, they are very, very submissive. And then obsessive compulsive disorder, you can see I'm showing a picture of somebody washing their hands, right? I got this picture from Wikipedia. So they are perfectionists. Hello, please, can you hear me? Can you hear me? Can you hear me? Can you hear me? Please, can you hear me now? Hello? 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 Can you hear me now? Okay, good. All right. All right. Thank you. Thank you. I'm very glad that I have people who are looking out for me. People are calling. Can you imagine? People are calling. Hey, Dr. Brody, we can't hear you. What are you doing? Okay. All right. So I think you can hear me now. Okay. So what did you miss, please? What did you miss? Tell me. Type it. Let me go back if I have to go back. What did you miss? Did you miss something? Did you miss something? Okay, I should go back to the OCD slide. This one? Is it this one? Please. Is it this one? Okay. All right, OCD. So let's go back to OCD. Sorry about that. I don't know what happened. Sorry about that. Okay. So with the OCD, they are perfectionists. Thank you very much, doctors. Thank you so much. You know, we are doing this together. We are doing this together, and we are not leaving anyone behind. So since you guys got me to go back, you need to subscribe to the YouTube channel right away. You need to subscribe right now, and click on the like and notification button. I didn't know that people were following that much. Please, I've had about 3 calls right now. So please click on the like and subscribe button. Click on the like and subscribe button on YouTube and Facebook, and then share. Okay. Good. Okay. So let's go back to the obsessive compulsive disorder. So these guys are perfectionists. They are rigid, and they are preoccupied with control. All right. They are preoccupied with a lot of control. And I was talking about the fact that obsessive compulsive disorder, the name even tells, okay? They have obsessions and they have compulsions. So the obsessions are intrusive thoughts, you know, where they have persistent, unwanted thoughts, urges or images that cause significant distress or anxiety. All right? And they have fear of contamination, fear of causing harm, need for symmetry. So that's why I got to, where they want their pen aligned, they want their dress aligned, they want everything. Someone says they can't hear again. Please, can you hear me? Doctors, please, before I move on, can you hear me? Someone says they can't hear again. Dr. Noel says, I can't hear. Please, can you hear or not? Can you hear or you can't hear? We can hear you. Beautiful, beautiful. Okay, good. So, compulsions, you know, they are ritualistic, okay? Actions, and it helps to alleviate the anxiety, like washing of the hands, like checking the doorknob regularly, you know, like arranging things over and over again. And sometimes, you know, they have compulsions with mental acts like praying all the time, counting all the time, you know, repeating words silently to themselves. So that's another thing. So doctors, now let's jump into some questions. So, a 35-year-old man with a history of borderline personality disorder presents the emergency department after a second suicide attempt within a year. He also reports difficulty maintaining relationships and has a comorbid diagnosis of major depressive disorder. Which of the following is a common adverse outcome associated with personality disorders? A, increased susceptibility to infectious diseases. B, reduced response to treatments for mood disorders. C, improved interpersonal functioning. And D, reduced risk of premature death. What is your answer? Which of the following is a common adverse outcome associated with personality disorders? A, increased susceptibility to infectious diseases. B, reduced response to treatment for mood disorders. C, improved interpersonal functioning. And D, reduced risk of premature death. I can see a lot of people going for B, 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 B. A lot of people are going for B, 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 B. And the answer is B. Reduce response to treatment for mood disorders. So B is correct. Okay. So A, increased susceptibility to infectious disease is incorrect. While physical health can be impacted, there's no specific evidence which links personality disorders to an increased susceptibility to infectious diseases. So Dr. Ter Merin, please look at your answer again. The answer is not C. The answer is rather B. Next question. A 28-year-old woman with antisocial personality disorder reports engaging in frequent reckless behaviors, including drunk driving and unprotected sex. She also mentions having multiple unplanned pregnancies in the past. Which of the following is the most likely adverse outcome associated with a personality disorder? A, comorbid cardiovascular disease. B, high-risk sexual behavior. C, functional improvement in work performance. And D, reduced risk of comorbid substance use disorders. What's your correct answer? Is it A? Is it B? Is it C or D? So I can see a lot of doctors going for B, 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 B. A lot of doctors are going for B. And the correct answer is B. Because they are impulsive, they are reckless behavior, including high-risk sexual activity and unplanned pregnancies, right? Are well-documented adverse outcomes of individuals with personality disorders, okay? So let's look at the impact of personality disorders, because the medical council wants us to know that. You remember they said it in the objective, right? They stated it in the objective. Impact of personality disorders. So personality disorders are important risk factors for a variety of medical and other psychiatric difficulties. Adverse outcomes for patients with personality disorders include A, physical injury from fights due to impulsive or reckless behavior. B, or next point, suicidal attempts. They are also at increased risk of unplanned pregnancy and high-risk sexual behavior, comorbid anxiety, mood, and substance use disorders, and less favorable response to treatment for depression and anxiety disorders and substance use disorders. And they have comorbid physical disorders, including cardiovascular disease, arthritis, diabetes, gastrointestinal conditions, and they have functional impairments as well. So they have lack of self-care, concerns at work, interpersonal functioning, and premature death by accidents, natural causes, or suicide. So they have reduced life expectancy. So in patients with personality disorders, risk of reduced life expectancy, risk of comorbid mood and substance use disorders, risk of suicide attempts, physical injury, cardiovascular disease, and all those things. So now, we're going to do fill-in questions just to solidify our concepts. So with all that we've done so far, doctors, please, we are now going to do fill-in. So it's going to still be MCQs, but remember that what we did last week, where we give you an equation and you need to fill in, because I want to make sure that you've gotten the concepts right. I really want to make sure that you've gotten the concepts right. So we're going to add another layer to just build our learning. All right. But before that, I want you to know that come 8th of January, we're doing our first med drill. So med drill is like exactly what you're seeing. The doctor is there and there are doctors there and he's just drilling them, right? You know what? At MedCognito, we see the MCCQE1 as, it's a battle. So we are doing everything possible. Like, you can ask them, those in MedCognito. Yesterday, we had a study, a library session where some candidates, like it was a quiet library, and people came in and we're just studying together. Everyone is reading, but it's an accountability session, right? And we'll be having more of that. And so we're going to have med drill. Med drill is a top class for everybody. It's a top-up class for everybody. Both MedCognito students and non-MedCognito students, okay? You decide what you want us to review. So this month, the Medcognito students said, Dr. Bruni, we want you to do ethics. So this one, I'm coming to drill them on all ethical concepts for 6 hours for this month. All ethical concepts for 6 hours. The first one will be on January 8th. The next one will be on January 20th. All those in Medcognito class right now have access to it. And this is my special time with. So it's like, the general coming and quizzing everybody. So it's going to be wonderful, right? So it's January 8th and January 20th. It will be 6 p.m. EST. 6 p.m. EST. Whether you're in Medcognito, you're not in Medcognito, you can attend it. 6 hours with me. All right? Those in Medcognito, we'll record it. We'll put it in the portal for you. If you're in Medcognito, it is free. This is a top-up beyond the 8 classes you have a month. All right? And but if you're not in Medcognito, you have to pay for it. And you will not get a recording if you're not in Medcognito. But if you're in Medcognito, you get a recording. And you will get it with every other thing Medcognito has to offer. All the live classes. So doctors, if you want to even just jump into our ethics program, you can just register for a month and join us. I just want you to know about it. So if you're not in Medcognito, you can use this QR code to register. Okay? And what I will also do is I will also drop the link to do the registration. Please don't forget that we are coming to do more questions to solidify the content. I'm just trying to let you know what is coming up in January. So if you're not in Medcognito, you can scan the QR code right now and you can use that to register at a very low fee, or I'm putting the link in the comment section to just join that med drill. Remember that if you're not in Medcognito, you will not get a recording. If you're in Medcognito, it will be put in your portal so you can go back and review it. And we are still getting great news from Nigeria again. Our doctor from Nigeria scored 301 in the QE1 for the October session. And we are very, very glad about that. Doctors, this can become your reality again. And then someone as well from Nigeria said this: thank you, Chief, for all you do. This was my New Year message, and I want to share it with you all. Being the greatest supporter for us IMGs, for taking us by the hand during this journey, thank you. For being the doctor that is very accessible, thank you. For making us comfortable to call you our own, thank you. For being a cheerleader even when we fall, thank you. For your spiritual counsel, thank you. Thank you for making 2024 academically smooth for me. Particularly, my NAC was superb. So NAC OSCE. And we are starting NAC OSCE classes as well on January 7th, right? So if you want to do NAC OSCE as well, you can join us. I'm grateful, sir, and wish you the best in growth, greatest in Medcognito development, and biggest in God's favor in 2025. Cheers. So you know what? I'm just here to do my best to make sure that we all get to the finish line. And messages like this really gladden my heart. So doctors, come on board. Let's help you to go through it. So back to the questions. Let's go. This one, paranoid personality disorder, let's use an equation, is equal to distrust plus suspiciousness. And they interpret others' motives as A, kind, B, malevolent, C, benevolent, and D, neutral. Paranoid personality disorder. They have distrust and suspicious, and they interpret others' motives as A, kind, B, malevolent, C, benevolent, D, neutral. Beautiful. So it looks like everybody is going for malevolent. So paranoid personality disorder is defined by interpreting others' motives as harmful or malevolent, right? So they are always suspicious of other people. Kind and benevolent and neutral do not align with suspicious nature. Okay, question number 2. Schizoid personality disorder. Detachment from dash plus restricted range of dash. Schizoid personality disorder. detachment from A, social relationships, and B, emotional expression. B, authority figures and interpersonal control. C, work environment and flexibility. D, reality and cognitive function. What is the correct answer? What's the correct answer? Is it they are detached from social relationships and restricted range of emotional expression? Or B, they are detached from authority figures and restricted range of interpersonal control? Or C, they are detached from work environments and restricted range of flexibility? And D, they are detached from reality and restricted range of cognitive function. What's the correct answer? It looks like everybody's going for A, and the correct answer is A. Schizoid, they are detached from social relationships and emotional expression. Okay, and they have limited, restricted range of emotional expression. Okay, next question. Schizotypal personality disorder is equal to social interpersonal deficits plus cognitive stroke perceptual A, clarity and organized behavior. B, distortions and eccentric behavior. C, precision and reserved behavior. And D, distortions and conforming behavior. What's the correct answer? What's the correct answer? What's the correct answer? What is the correct answer, doctors? What's the correct answer here? What's the correct answer? What's the correct answer? What's the correct answer? So the answer is B, 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 B. So schizotypal personality disorder, social interactions and interpersonal deficits plus cognitive or perceptual distortions and eccentric behavior. So you see, I'm trying to make it a bit difficult so that I can put it together because this helps me to know that you've really cemented it. Okay. Next question. Antisocial personality disorder. They have the disregard for others plus A, stealing and neglect of dependence. B, empathy and neglect of rules. C, recklessness and neglect of social norms. And D, kindness and neglect of responsibility. Dr. Bironke, this one you got it wrong. Dr. Tabo got it right. So remember, antisocial personality, did you have disregard for others plus they are thieves, right? At times they are thieves. And neglect for dependence. Remember that I told you that in the lecture, right? So antisocial personalities include criminal behavior and neglect of responsibilities. And they neglect responsibilities as well. Okay. Now, borderline personality disorder. Instability in dash plus instability in dash plus impulsivity. So they have instability in relationships and instability in self-image. That's A. Instability in work habits and instability in physical health. That's B. Instability in social standing and instability in perfectionism. That is C. Instability in reality and instability in cognitive function. What's the correct answer? What's the correct answer? What's the correct answer? And the correct answer here is A. 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 So borderline personality disorder is marked by unstable interpersonal relationships and self-image alongside impulsive behavior. Okay. Next question. Histrionic personality disorder. They have excessive A, emotionality plus attention seeking. B, excessive control plus attention avoidance. C, excessive rationality plus attention retention. And D, excessive calmness plus attention given. Doctors, I'm trying to mix things up a little bit so that we can really, really think. So what is the answer for histrionic? The answer is A, 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 A. So histrionic disorder involves dramatic emotions and craving attention, and other options do not reflect the dramatic and attention-seeking nature of this disorder. Next one, avoidant personality disorder is equal to dash plus feelings of dash plus hypersensitivity to negative evaluation. Avoidant personality disorder. Social inhibition plus feelings of inadequacy plus hypersensitivity to negative evaluation. B, emotional withdrawal plus feelings of superiority plus hypersensitivity to negative evaluation. C, assertiveness plus feelings of perfectionism plus hypersensitivity to negative evaluation. And D, social interaction plus feelings of empathy plus hypersensitivity to negative evaluation. And everyone went for A. And that's the correct answer. Doctors, please. How is the exercise today? How is the exercise? I want to know. Before we move on, how is the exercise today? How is the exercise today? How is the exercise today? How is the exercise? Is it making it ridiculously simple for you? Okay, good. Next question. Obsessive compulsive personality disorder is equal to preoccupation with dash plus mental interpersonal dash plus loss of dash. So preoccupation with perfectionism plus mental interpersonal control plus loss of flexibility, or preoccupation with chaos plus mental interpersonal connection plus loss of purpose, or preoccupation with detachment, that is C, plus mental interpersonal withdrawal plus accuracy, and D, preoccupation with spontaneity plus mental interpersonal openness plus loss of precision. What's the correct answer? And I see a lot of doctors going for A, and A is the correct answer. So doctors, thank you very much. Just wanting you to know, if you want tutoring like this, if you want support like this, which we give our students 24/7, just jump in to the MedCognito program. When we talked about it, like 2499, people said, oh, Dr. Bonnie, it's too high. So we said, okay, that's fine. So it's only 2199 for 6 months, okay? 2199 for 6 months, 2199 for 6 months. You have the option of paying monthly, that's $420 every month for 6 months, or paying 3 times, that's $799 3 times, or twice, that's $1,050 a month twice, or one time, $2,199, and you'll get access for 6 months, where you'll get access to every live class, you get access to me, you get access to other colleagues, you can form study groups and enjoy your studies. So you can pay one time, can pay 2 times again, can pay over 3 months or three time payments, or you can pay monthly for 6 months. Doctors, the choice is always yours. But remember that when you do this and you get into the program, you have access to the med drills, you have access to everything. You have access to med bullets, you have access to everything in MedCognito. All right. So if you are interested, I'm going to drop the link in the comment section and you can use that to register right now. Okay. We've made the payments flexible so that everybody can take advantage of it. Again, remember, we have med drills. Come January 8th, in 3 days. The slides are ready. I am ready to go. And it is open to everybody. Whether you're a MedCognito candidate or you are not, you have access to it. But if you're a MedCognito candidate, there's no need to pay anything. 6 hours with me, 3 hours on January 8th, 3 hours on January 20th, where we're going to go through everything ethics. Everything ethics. Just to make sure that we've gone through it. I will advise that jump into the MedCognito program so that you can get the whole thing for free. Okay? The med drills, because we want to really prepare solidly for this upcoming exam because of the changes in the exam. And so we are leaving no stone unturned. We are reviewing objectives day in, day out in our WhatsApp group. Okay? So doctors, this is it. Med drills is here for you. Okay? And remember, can still get access to the MedCognito portal, and we can get things going. You can reach out to me right now on +1 306 891 5649 +1 306 891 5649. I'll make myself available for the next 1 hour after this class to respond to all the messages and all the calls. I'll prefer WhatsApp so that wherever you are outside, even outside Canada, you can still reach out to me. This is my phone number. I'm waiting for the first caller, and then we can help. +1 306 891 5649. The first person who wants to call can call me, and we can start studying. Doctors, thank you very much. As usual, this is your friend, this is your brother, this is your colleague, this is your partner in your MCCQE1 and Canadian exam journey, Dr. Brony. Thank you very much for spending your afternoon with me. See you tonight in the respirology class for those in MedCognito. See you again on January 8th. See you again on Thursday. See you in the WhatsApp group. Let's continue to study. Let's ace the MCCQE1. Thank you very much. Have a good day. Bye-bye.